Hello, 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 hello. So you guys know today we're talking about the musculoskeletal system, okay? And I found my book that I used to use. I still do, but I felt like we should pull it out so we can kind of get talking about some of these things. So this is an illustration, and this is what I'll be saying is in the CPT book, okay? So the illustrations that's in the CPT book, you guys are going to look over those as well. Okay, I know the camera is amazing. I got a new camera, as you guys can see. I got a new camera because I knew something was wrong with the other one, and we were like, we got to get a new camera. So we got a new camera. So that's why you guys can see me today. But again, we're going to do musculoskeletal system. But you guys remember, some of you who were in my class with me before, I like to use this book as well. Even though, today we're doing musculoskeletal system, I wanted to kind of pull some of this out because some of this will be on your CPC. Those of you who are going on to complete your CPC, um, there are a lot of vocabulary words here as far as terminology that you should know. We do go over them, but I'm just going to kind of like point out some that I want you to go over. And I'm backtracking to the body structure. You guys remember the first chapter was the body structure. Okay, so I want you to make sure you remember what the thoracic is, diaphragm, pelvic, dorsal, cranial, spinal, abdominal. Okay, make sure you get those definitions down for that. Okay, this is an illustration. I haven't put this up because more than likely this is going to be in that medical terminology book, but you can't see this. But as far as how the body structure is, the CPC may ask you, where certain parts of the body are. Your cranial, your spinal, your thoracic and your chest, your diaphragm. Remember I told you that was under here. Okay, your pelvic area, that's back here. Your gluteus maximus is your backside. Things like that, they're going to ask you, where they are. Okay, so I just wanted to kind of touch bases on some of those too. In the first chapter, we talked about anatomical planes. Remember, I can't show you this picture because it's a little too much, but make sure you get the inferior, lateral, anterior, superior, posterior, back in order. In your medical terminology book, you should have an illustration in there on this one, okay? And it should have the planes in it. The planes are, they're like mirror-like, they kind of split your body together. So on your CPC, they may say, what direction is superior in? Where is posterior? Posterior is in the back. Where is anterior? In the front. What is lateral? Okay, those are the type of things that the CPC will ask you. Okay, and I wanted to touch bases on that. Even though we did it in the first chapter, I just want to make sure we backtrack on that. When you stand in erect, your hands are like this. So if you're on your CPC test and they ask you, what is the posterior for erect? You understand what I'm saying? So these kind of things they're asking you. The CPC is not going to ask you like off the wall stuff. They're going to ask you stuff that's on an everyday basis that you see, in a hospital or in a physician office. Okay. So I just wanted to kind of touch bases on some of that. Just make sure you understand that cervical neck portion, the pelvic portion. Okay. That is going to be your test. They're going to ask you something about that. And for those of you who are not going to go on to take your CPC, that's fine. You still need to know about the body. You still need to know about the abdomen. You still need to know medical terminology because even if you're doing medical billing and you have to look at an intake or you have to look at a 1500 claim form, you still want to have an idea of what's on there. We haven't gotten into revenue codes and all that stuff yet, but as a medical biller, you still need to know what the revenue codes are. When you guys go to sapphirephysiciancoding.com, click on one of those sites. I have a list of revenue codes that go on the UB92, so you guys can kind of get an understanding of what those UB codes are. So this is again, this is kind of me just kind of backtracking over a couple of things that I could spot that's going to be on that CPC exam, and that's what it takes. You guys going to have to set a study time for yourself because just there's no way you're going to be able to do it without the study. And I don't know if we went over the hand, the abduction, adduction, flex away. That I want you to go over. We're going to probably go over that today in your chapter. I just wanted to hit a couple of bases that I ran over in this book. We did go over cells and tissues. We went over that. But again, when we go over it in the classroom, I'm expecting you to do your hour after me. Okay? So we did the cells and the tissue. Okay? I want you guys to make sure that you remember the red blood cells transport oxygen from the lungs to the tissues. So if they give you a question, well, what does the red blood cells do? Transport oxygen from the lungs to the tissue. So if you have a multiple choice question and one of those is your question, that's going to be your answer. So you guys remember, Ms. Lambert always say the answer is in the question. It's in the question, okay? I'm not talking about the cases. The cases, you already know the answers in there. But when you get those open and closed cases, the answer is in that question, okay? So I just want to kind of backtrack a little bit. Cells are the simplest living units of the body. They are made of inorganic and organic chemicals. Cells with similar structure and function form tissues, and an organ is a group of tissue arranged to perform specific functions. Just want to throw that in there. We already went over it. I'm just kind of backtracking just to kind of give you that, those tips that you need to make sure you pass that test. Okay, so just make sure that you are clear on carbohydrates, glucose, okay, lipids, proteins. You must know what those are, okay? On your CPC exam, yes, multiple choice, but those are the kind of things that's going to be there. We talked about plasma and cells, red blood cells and plasma, 55% plasma, 45% blood. This one I didn't give you because we didn't go over this one. There's about 55% to 60% of water in an adult human body, okay? And I'm reading this just right, exactly from the medical terminology book. This is a medical terminology book too. It's just a smaller version of medical terminology. And I wanted to kind of touch bases on some of it. So in this book, I'm just giving you stuff that I want you to retain, that I want you to use as far as your study. So on your CPC exam, you will see words like diffusion. Okay, take heed to that. Put that on the index card. Diffusion. A substance moves from an area of greater concentration to an area of lesser concentration. Okay, osmosis, the diffusion of water through a membrane. Okay, phagocytes, I want you to remember that. A moving cell, okay, engulfs particulates as when white blood cells engulf bacteria. That sounds like CPC to me. Okay, and I gave you tissues. We didn't do the full chapter. You were supposed to do the full chapter. I just kind of take out some things that are in this portion. But I want you to get this because this may be on your test. So a tissue, we're talking about tissues. A tissue is a group of cells with similar structure and function. The four groups of tissues are epithelial, connective, muscle, and nerve. I'm going to say it again. The four groups of tissues are epithelial, connective, muscle, and nerve. Okay? Make sure you get that down, okay? And on your index card, you're going to put that definition down as well. I'm not going to read the whole thing. I want you to go ahead and look those up. Epithelial tissue, cover or line surfaces, have no capillaries, and are often capable of secretion. Connective tissue, connect or support body parts, consist of cells, and a non-living intersectional matrix. Make sure you get those because I have seen those in that exam. Okay, just make sure you get those. The integumentary system, we haven't gotten up to that series yet, so I'm not going to go over anything in that until you guys actually go over that. Today we are going over the musculoskeletal system, and I just wanted to touch bases on a couple of other things with that. Bacteria, make sure you get down bacteria and what it is. Bacteria are single-cell organisms that come in a various shapes. Okay, I'm not going to do the whole thing. Viruses, make sure you get down viruses. The gist of the CPC in the medical terminology section and all sections is to see if the to see if the students have read and studied medical terminology. Let's see if the students have read the CPT book. Now, I've got the CPT book open to musculoskeletal system. I'm going to show you that in a few minutes. I have it open because when you are studying, I'm not doing human microbodies, we're not doing that one. When you have, when you're studying your medical terminology, have your CPT book open to the section that you're doing, okay? So in this medical terminology book, it has a skeletal system and it has a muscle system. Here is a musculoskeletal system. It's the same thing. They're going to do both, okay? So here, okay, we did that one already. Make sure you get this illustration, okay? This illustration, I got it out of the CPT book, okay? Matter of fact, I think I'm still on the CPT book, okay? And this is from Kindle. Okay, so this is the free version from Kindle, okay? And Kindle goes up to the musculoskeletal system. So I think I'm going to do 2 days on the musculoskeletal system because I need to make sure that you guys know that you can get that book from the Kindle and Amazon, and the E&M you can get, and integumentary system and musculoskeletal system is free, okay? Let me get to it. It is free. So there's nothing that we're doing in this book that we should not be doing. Okay, it's an open book. So again, this is the musculoskeletal system. This is the illustration in the musculoskeletal system. Every chapter in the CPT book, okay, we're not on the coding yet, but I'm going to show you how the medical terminology book must be combined with the CPT. So this is the medical musculoskeletal system. It's the muscles and the skeletal system together, okay? So these are the guidelines for it. In every single chapter, every single series, there are guidelines that you must read, okay? This has a full guidelines in it. It's about fractures, dislocations, treatment, manipulation, put the bone back in place. The bone comes out. Sometimes you can just kind of manipulate it back in place. Open treatment, closed treatment, open treatment, bone that's already protruded to the skin. Closed treatment, the bone that's not protruded to the skin. There's no surgical treatment necessary. So, again, we're on the musculoskeletal system, and we're just kind of going over some of this, okay? Let me go back and make sure you can see what I see. So, when you're studying for your CPC, even if some of you are not taking your CPC, if you have the material in front of you, you'll be able to retain it. Don't study up until 2 hours of you driving to take the test. Do your studying that morning, you're done. Do your studying that night, you're done. This is the musculoskeletal system in the CPT. And the reason why I have this open is because we are going over the musculoskeletal system. So I want you to be able to read these guidelines. That's why I said we might take 2 days to do musculoskeletal system because I want to give you guys time to get this thing from the Kindle. Okay. See, I have a Kindle account, so I have the books already, but I want you guys to get the books. Okay. So again, this is from Kindle, Amazon.com. Make sure you go there. I like the ebooks. You guys know I like the ebooks, okay? So again, this is the guidelines for musculoskeletal system, and here they're showing you modifiers that they normally use with this section. Modifier 54 should be appended to the fracture dislocation treatment code. If treatment of a fracture as defined as above is not performed, report an evaluation and management code. 99, that's a 99 code, okay? So, some of you guys wanted to know, what the coding is. Some of you guys are kind of popping in as to what the coding is. We're not sure what the coding is. In the beginning of this book, it gives you a definition of coding. We're taking words and we're deciphering them into numbers. We're taking reports and we're deciphering them into numbers, and we're putting them on claim form so the bills can be paid. Okay, so again, this actually has a full section of the musculoskeletal system in this book. Okay, and again, we're gonna start from the beginning. And you guys remember what I was telling you about trauma hospitals and different things like that, like what happened in New York. Jamaica Hospital is a trauma hospital. I worked at Jamaica Hospital. I don't know. I was about 18 years old. I think I worked at Jamaica Hospital. I was a CNA at Jamaica Hospital, and Jamaica Hospital is considered a trauma hospital. Most of the gunshots and horrible stuff, somebody doing something to you, is done there. Most of the trauma. I think the officer who got shot is actually at Jamaica Hospital. But again, they do a lot of trauma. They do a lot of wound care. Queens General too. They do a lot of trauma, a lot of wound care. Like North Shore, Long Island Jewish, where I used to work at, it's more, heart attacks and old people. And, I got hit by a car. God, I admit that. You know what I mean? So there's different types of facilities. But again, depending on where you're going to work at, you will use this book for those purposes. I mean, you probably have an app, you may have Optum 360 or something like that as far as the coding is concerned, but you still need to use your books, okay? So again, just make sure that you use your CPT when you're studying and your medical terminology book, okay? So I'm not going to go through the whole book, but I wanted to show you how we're going to study. So I'm going to take this down. I'll stop the share on that one. And I got the fan going and it's still too hot in here. So yeah, we're going to turn it on. I'm so pleased with this camera. It's like ridiculous. Let's share screen. All right, so let's go to my Elsevier library. And don't forget elsevier.com. No, I'm not going to go over the books the whole time. I want you guys to look at other chats. Look at those links down below so that you can see what type of books we need. I'll go over them again if you guys want me to. Okay, so here we are. This is where we're at today. And again, you guys see the CPT book that I showed you. We can combine that with this. We combine that with this, with the medical terminology, okay? And this is what we are doing today. We're doing musculoskeletal system today. It definitely looks pretty lengthy, so I know we're not finishing that today. But if I get to an hour, y'all gonna be tired. Y'all ain't gonna wanna go through this no more. So those of you who are archiving this chat, I ain't gonna keep you more than an hour. Okay, but I still want you guys to do your studying after the chat. Okay, so again, we are on musculoskeletal system. Your CPT book should be on musculoskeletal system. Okay, so in my medical terminology book, so I have two. This one is kind of like my miniature book, and it just tells us about the musculoskeletal system. The skeletal system consists of bones, cartilage, and ligaments. The human skeleton has two divisions. CPC, when you hear me say stuff that is contrary, it will probably be on the CPT. They want to know, do you know that there are two sections of the body as far as the bones? The axial and the appendicular. Y'all know I can't pronounce nothing, but I got it in my brain. Okay, the axial and the appendicular skeletons. The axial skeleton forms the axis of the body. Okay, we're talking about the bones. The appendicular skeleton consists of bones that form the shoulder and pelvic girdles and the upper and lower extremities. Because you guys know we have different types of reflex that are automatic and reflex that we purposely do ourselves. Okay, so functions of the bone: support and movement. Bones are the support framework of the body. They form joints that are moved by skeletal muscles. So this is primarily what's in your objective that's actually in my objective in the musculoskeletal system. So this is pretty much the same thing that you're going to find in my medical terminology book that I just finished writing that has your tests in there. So remember, that medical terminology book that I just finished writing has 50 tests. 50 exams are in that book. I also put the answers in that book to help you. This is for my YT students and the Sapphire students. You have to have something to study by, and you need to have tests. Okay, so make sure you go to Amazon.com and get that. Okay, so we've talked about the functions of the bone. We are in musculoskeletal system. I'm just starting with a different book other than the language of medicine book. Okay, supported movement. Okay, bones are the supportive framework of the body. They form joints that are moved by skeletal muscles. Protection. Bones enclose and protect other organs. Why do we need bones, Miss Lambert? Because they close and protect other organs. Okay? Let me tell you something. But the medical terminology is much more fun than billing. I'll tell you right now. Okay? Okay, as the skull protects the brain, eyes, and ears, and the rib cage protects the heart, lungs, liver, and spleen. I mean, that's kind of self-explanatory, right? The skull protects the brain. Your diaphragm protects everything that's in here. Your ribs, protect your lungs. You know what I'm saying? I mean, the bones are very, very important. In certain portions, you break them, you leave something exposed. I don't know if anybody's ever been in on a craniotomy. Some of my nurses out there that work in the OR room, you know how they do the craniotomies with the drill hole and everything. And I mean, the surgeon is literally taking the skull off. And I mean, we're there literally looking at the skull. I mean, that's one of the reasons why I left the OR. I just can't. I just can't. My sister, she's good with that kind of stuff. I'd be sitting there having a nervous breakdown. But again, your skull is protected. Your brain is protected by your skull. Okay. Let's talk about hemopoiesis. 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 Is that a word on your CPC? No. Okay, but we're going to give it to you. The red bone marrow forms all of the kinds of blood cells: red blood cells, white blood cells, and platelets. Wow, I used to spot right here. In an infant, because I don't usually go to spot. In an infant or child's body, all bones contain red marrow as the body ages. Well, we know that. Okay. But again, some of these words I definitely want you to retain. Okay. Bone tissue, bones and organs together. Bones may be classified as long. This is tests. Okay. So if on your CPT they ask, what kind of bones do you have? Okay, so that you're going to remember, the human skeleton has two divisions. That you're going to remember the exoskeleton and the appendicular skeleton. On the CPC, if it says how many divisions does the skeleton have? 2. If you have multiple choice questions, 2. Appendicular skeleton, exoskeleton. If it gives you some off-the-wall crap, you know that's not it. Okay? Take heed to bones, function of the bones. Okay, what I just told you. Bones support the framework of the body. Okay, that form joints. They form joints that are moved by skeletal muscles. Take heed to that. And when I give you something, I want you to study that. Make sure you take heed to that for your exam. Okay, bones and organs. I want you to take heed to this. Bones may be classified as long, short, flat, or irregular. Long bones include femur, humerus, and phalanges. Short bones include the carpals and tarsals. Flat bones include the ribs and the temporal bones. Irregular bones include the vertebrae and earthmoid bone. Short, flat, and irregular bones are made of spongy bone covered in a thin layer of compact bone. Okay, but the main thing I want you to remember is long, short, flat, and irregular. Okay, that's it. Okay, but again, that's part of your class. Okay, So what I'm giving you right now is things that I want you to kind of write down and make sure that you retain, okay? The cranium. The cranium is made, that's the base of the brain. The cranium is made of 8 bones, okay? The frontal, okay, I don't want to move too fast, but I still want you guys to write this down. I've skipped a few pages, but I want you to write this down. The cranium brain case is made of 8 bones. Frontal, 2 parietal, 2 temporal, occipital, sphenoid, and ethmoid. The 14 facial bones are 2 maxillae, 2 zygmots, molars, 2 nasal, 2 lacrimal. That's not going to be on the test, so don't need me to give you that. What I want to give you is specifically what I think is going to be on the test. Okay, so let me highlight that because I want you to remember that. Okay, that's the exoskeleton. The exoskeleton portions that I just gave you. The exoskeleton consists of the skull, vertebrae, which is your spine column, and the rib cage. The skull rests on top of the spinal column. Okay, so that's part of the axle right there. So just make sure you get that. Okay, remember the other part is the appendicular. In the appendicular skeleton, the pairs, scapulae, and clavicles from the shoulder girdle to the upper limb. The humerus, radius, ulna, 8 carpals, 5 metacarpals, and the same thing in your feet. It says the same thing that's in your hands and your feet. 2 hip bones from the pelvic girdle. Okay, we don't need to know that. Appendicular axle. Okay. Let's see what else in here. I'm gonna pull from out of here. All right, so we ain't talking about no growth hormones and none of that stuff, but just make sure you know about the vertebrae, okay? Osteoporosis, I don't know what they give in that. But make sure you know about the vertebrae, which is up on top of the bone. They also show your disc in here, your hernia disc, your normal disc. That's in between. I haven't gotten to that part yet to show you that, but I just came across that here. Make sure you guys get this down. We're going to go through this on the other one, but I'm just giving you this real quick. This was on the test, okay? What is a simple closed fracture? What is a compound open fracture? What is a green stick fracture? What is a comminuted fracture? Get the definition of those, okay? A compound fracture. You know what a compound fracture is because it has open right on it. So you know it's an open fracture and it's pierced through the skin. Okay, a green stick fracture is like a twig. It's like a twig. You know how you break a branch and it doesn't fully break, it just breaks a little bit? That's a green stick fracture. Okay, a comminuted fracture is a fracture that has ruptured, like it's raggedy, but it hasn't broke off. Okay. Simple close is that it's just cracked. It's not really broken. So make sure it's broken, but you know, it's not apart. So simple closed, compound open, green stick, and comminuted. Is that going to be your test, Ms. Lambert? It was on a couple of my students' tests. Make sure you get it. Okay, and that's types of fractures. Okay, AAPC is very particular about putting this on there because it has to do with the musculoskeletal system. Okay, you still can get spiral fracture, oblique fracture. This is an oblique fracture when it's a fracture. See how this pin is going like that? That's an oblique fracture. Transverse fracture is a fracture that's right straight across. Okay, so they may have A, B, C, D, you know, if they say, what is an oblique fracture? A slanting fracture. Or they might even have a little tiny bit of an illustration there. Okay. This one is a depressed fracture. It's like a piece of bone that just came out. Okay. I didn't intend to go with most of this, but I love this book. I'm telling you, this is like my favorite book right here. So again, I just wanted to kind of touch bases on some of the things that are in there that I definitely want you to go over. Your humerus, okay, your radius, okay, ulna. Okay, your elbow joint, and I'm gonna show you where those things are on here. Okay, your scapula, your shoulder joint, some of it you already know. Your radius and your ulna. That radius is going to be inside, and the ulna is the bigger bone. It's going to be on the outside. It's the bigger one. Okay, your humerus, and that's the one I used to get messed up all the time. With the femur and the humerus. So where's your humerus? Where's your femur? I always remember humerus, and I think of hand, and I remember humerus, and then femur, foot, down there. Okay, so that's a trick. So I will write that down. Okay, so that's how that's going to be in your test too. So take heed to that. Okay, your femur and your humerus. Okay, radius and your ulna, your vertebrae. You know your vertebrae is in the back. It's like the locks that's up over your tissue. Carpal tunnel. No, we're not looking at carpal tunnel. Well, we are. When you see something metacarpal, you know that's where they get the carpal tunnel from. Okay, and I have something in there on in the musculoskeletal system. There is pictures of the bones there in the musculoskeletal system. Okay, so again, you know the skeletal system anterior, your cranium, maxilla, clavicle, scapula, humerus, okay, radius and ulnar, metacarpals, okay, phalanges, that's the top part, the tip part, okay. And here it is, your femur is the first portion of your leg. Your femur, your patella is by your knee, your tibia, your fibia. Your fibia is the smaller one, the tibia is the thicker part of the bone on the bottom of your leg. Your tarsus, metatarsus, and phalanges are your foot. Phalanges are your tips of your fingers or the tips of your toes. So again, you must know this before you take your CPC, okay? In the musculoskeletal system, in one of my courses on my website, you have a full body system of this in here, and I pinpointed what you need to know for your CPC, okay? Even if you guys are not taking your CPC, in medical terminology, this is still what you need to know. So do not forget, there's your axial and then your appendicular, okay? And don't forget, there are flat bones. Those flat bones, make sure you remember. Like you see, like your pelvic, that's a piece of part of your fat bone, okay? Your coccus, your pubis, your ischium, the back clavicle. This one was just showing the back of the same thing that's over there, that's all. But your main things is your clavicle vertebrae, your scapula, your humerus, your femur, your ulna, your radius, your carpals and metacarpals. They really just hit it on the nose of everything that you should know when you get ready to take your CPC. When we get ready to go through the CPC guide, the CPC guide is the end. That's when y'all know we start from the beginning, and then I take you guys to mastery level. So we start from the beginning, and then we go to mastery level. Okay. So again, you know, this is the anterior view of the skull. Okay. So again, you know, I want you guys to make sure that you look at the illustrations that are in your book. Okay. Especially maxilla. That's something that's definitely, they may ask you, you know, where that is. The sphenoid, they may ask you where that is. Orbital plate, they may ask you where that is. Okay, they may ask you where they have multiple choice. Where's your orbit? The orbit one is kind of like a common sense. We know the orbit is kind of tied into the eye. Okay, your temporal bone. Okay, your nasal bone. They will ask you some of these things just to see how familiar you are with the body parts. I'm trying to see if they have the mandala and let me see. They don't have the cranium, mandala. I want to show you the different parts of the brain, but it's probably on my book that we're going to go through. And this medical terminology book, I'm just kind of speeding through because I wanted you guys to get what might be on your chest. Okay, your occipital bone, yes. All right, your coronal suture, no, that's not going to be in your chest. Your occipital and your frontal, yes, they're going to know where that is. That's going to be on your chest, okay? That's going to be on your chest. Temporal, sagittal suture, occipital bone. I gave you occipital bone already. This page is amazing, but it's the same as the other one. The main things that I want to make sure that you got in there is your temporal bone, occipital bones, your temporal bone, occipital bone. Make sure you know what those things are. All right. I don't know what that is. They keep popping up there. Okay, so your frontal, your maxilla, C1, C2. So we didn't do the spine yet. I'm going to wait till we get ready to get to your medical terminology book, but I'm just kind of touching bases on it. Your vertebrae column, because again, you know, a lot of this stuff, you just need to touch bases on it in your in your exam. Okay, thoracic curvature. That's your back when you see that curve like that. And this is good because you guys hear what they say: C1, C2, C7, T1, T2. And then L5 and so forth. So C1 and C2, that's at the top. That's your cervical at the top. Your cervical C1, cervical C2. It says cervical vertebrae. So that's what when you see something like that on your test, and you see people see the C1, C2. Let's say you're reading a note and you're not sure what it is. C1, C2, C3, C4. I'm just giving you numbers. But C means cervical vertebrae, so you know that's going to be up here. Thoracic vertebrae, T1, T2, T3, T4. Thoracic vertebrae is going to be in your middle. I'm talking about the spine, but I'm just giving you that vertebrae because I'm in the front of you. Okay? L1, L2, L3. So if you have something on your toe, show us over L1, L2. In your CPT book, in the back of the book, they will have an illustration in there. And that's what I'm talking about. In your CPT book, go through the whole book. You're going to read every single thing in it because when you need to find an answer, you're going to find the answer in that book somewhere. So lumbar vertical, okay? Lumbar 1, lumbar 2, lumbar 12, lumbar 5. Lumbar 5 is by your sacrum on the bottom, okay? Not the sacrum, but your lumbar before you get to the sacrum. Your sacrum is going to be the sacral curvature, and your sacrum is S1, S2, S3, S4, right down by the bottom with it, like your tailbone. Sometimes you guys feel like pain right there. Sometimes you sit down, and you go, "What's that?" That's your tailbone. That's your sacral, and they might have S1. It goes to S1 to S5. So remember that when I'm giving you a CPC step. Okay, so remember C1, C2, C3. What's that, Miss Lambert? C1 cervical vertebrae. Cervical, you know it's C cervical, so it's going to be right here. Thoracic vertebrae, you know that it's going to, I'm talking about the spine, but we're talking about this portion of the spine, okay? T1, T2, that's your primary curve in your back, okay? You know how some people have scoliosis and they don't have that curve. Their curve is like tilted or to the side. Scoliosis is that's what it is, when your spine is tilted. Okay, so again, lumbar vertebrae L1, L2, L3. When you see that, that's what it means. Okay. All right, I ain't gonna go over too much, but I just want to touch bases on that. Okay. So again, we're doing musculoskeletal system, but I wanted to kind of touch bases on this because I love this book. This book is amazing right here. You see how it has a C4, C2 is the cervical. So it's going to be up by this part. I'm not talking about right here in your spine. That's the cervical portion right there. All right, so let me see. I just want to go a few more pages to this and then we're going to hit that. All right, so again, see, this is the rib part right here. But the only thing that you need to make sure you know your thoracic vertebrae. Okay, your scapula, your clavicle, make sure you know where those things are. It might say, where are they? Where is that? And then you know where to get it. Okay, so those of you who missed that section just a few minutes ago, make sure you archive that so you can get that section down. Okay, that we just went over. Okay, again, your humerus and your femur, make sure that you know that. Is that going to be an adjustment, Lambert? Yes, it will. They will have questions on everything they think you needed to touch bases on. So we went over this already. This is a bone of the right humerus and the scapula. I gave you what you needed for this, like your scapula, your medial, your lateral. Medial, lateral, not going to be in the test, but you still need that. I'm not sure what that is. I don't know who that is. Okay, so yeah, I'm not going to go over tendons because we still ain't hit your medical terminology book over there, but we did hit this one because of the musculoskeletal system. You guys can't see these pictures, but I'm going to show you some pictures in a few minutes. Your phalanges, your radius, and your ulna, your arm right here, radius and ulna right here, metacarpals. Okay, so it was something else I wanted to show right here. I think we did this part already. The muscular system consists of the skeletal muscles. made of striated voluntary muscle tissues and the tendons. Okay, so we went over that already, but I highlighted that, so I guess I wanted to go over the major functions of the musculoskeletal system. Muscular system. They're just and here is separate. It's skeletal and then muscle. Here, when we go over the Elsevier book, they just happen together. That's all. And I wanted to touch bases on this because I got it highlighted. So obviously, I wanted y'all to know what this is. The muscular system consists of the skeletal muscles made of striated muscle tissue and the tendons made of fibrous connective tissue that attach to the muscle bones. Okay, so you guys know that because we had went over that earlier, but I want you to make sure you keep that on your mind. Okay, we did that already. The role of the brain. They talk about the frontal lobes and XYZ. Make sure that if you guys can get a summary in, you guys will be able to retain it much better. All right, so I'm not going over any of that. So yes, you guys can get this book. I don't know. Let me see. Where did I get this book? Oh, I got this book from Barnes and Nobles. Okay, this book is by Jones, 4th edition. Okay, Anatomy and Physiology by Jones. Okay, Anatomy and Physiology by Jones, 4th edition. Make sure you guys get this book. Okay, and this is like a pocket book, and I mean this book is amazing. And just like I said, everything that's in the medical terminology section that we go over, that's going to help you pass your test, isn't all medical terminology material. This book has body structure, cells, tissues, integumentary system, human microbodies, skeletal system, muscle skeletal system, nervous system, the senses, eye, ears, endocrine system, which we went over, circulatory system, lymphatic system, we went over, respiratory system, digestive system, urinary system, reproductive system, and human development. You see, and it's all in this, it's like in the same order. And the more material that you have that you can go over, the better. Okay, so let me put this up again. All right, so that's what we're doing today. I know we went over the skeletal system and the muscles in here. I didn't go over too much of the muscles in here, but it was a combined effort in this book, and I love it. So those of you who are with me, I am on page 543, and we're talking about musculoskeletal system. So your introduction is talking about the bones, vocabulary for the bones, terminology, pathology, joints, vocabulary, terminology, pathology, muscles, vocabulary, same thing. They're kind of like repetitious. They're just going to do same thing how we did it in here, but the chapters just together. Okay, bones, and then they're going to do your joints and muscles. Okay, so in this book, let's see. I didn't see this picture. I could have put this picture up first. I love these like 3D type of pictures. Aren't they amazing? So we're already 43 minutes in, which, I mean, that's okay. But I spent a lot of time on the first portion. But I want you guys to spend the same amount of time on the first portion. I can't even talk. Because in your CPT book, you have to know musculoskeletal system. What I want you to do is start from the beginning. Start from the beginning. I know I keep trying to get to there, but I got to show y'all something. Real quick. In your CPT book, I got to go to the CPT book. In your CPT book, okay, when you get to, are we there? We're there. In your CPT book, this is Kindle, so this is free for everybody, so we ain't violating nothing. Okay, in your CPT book, this is your CPT book. Read all of the guidelines in your CPT book. This is considered guidelines in your CPT book. What they're doing is telling you what you're getting ready to start reading, what you're getting ready to start looking at. Okay, some of you who are not familiar with the coding, I'm gonna hit all the way right here. I'm going to the front. Okay, that's your CPT edition. This is the ebook, and I did put this link. This link is below, so you guys can get this. You click on that link, and this book should pop up. Okay, click on that link, and this book should pop up. Okay, I'm looking for, okay, yes. So let me see if I can get, there we go. So you guys see where it says introduction. Some of us are not familiar with what CPT is or what coding is. Don't forget, the link to this book is in this chat. All of my chats have the links to these books. You have the link to ICD-10, you have the link to CPT, and you have the link to HCPCS. It's all down below in this section. Open it. This book should open for you. YTU, Sapphire, this is for both of y'all. So some of you guys are not familiar with CPT. Read the beginning of this. Some of you have just popped in. The link to get this book is below this chat. It is free. Get the link. This is the beginning of the book, and this tells you what CPT is, what the learning of CPT is. How are you going to navigate through this book? What do we need to look at in this book? It tells you what category 1 is, tells you what category 2 is, tells you what category 3 is. This is going to be your go-to to understand the types of CPT codes. And there's a lot of websites down here that I want you guys to go on. It gives you an idea of what you're getting ready to get into. It gives you CPT code set updates. Yeah, some of this is going to be on your CPC exam. On your CPC exam, they asked this. When are the updates released for category 2? And when are they effective? Or when are the updates released for category 3? You never know what they're going to ask. Okay, so again, this is what you're going to read before you start anything. Okay, and this is giving you a heads up of, what is evaluation management? How is it sequenced? Okay, they're giving you some of the 70,000 codes, and they're just telling you how they are sequenced from 710 to 799. Okay, pathology, pathology is a blip when we get ready to get to it. Surgery goes from 10 to 69990. Okay, read this. This is free. Okay, I can't express it anymore. Okay, the link for this book is down below. Okay, I gotta see myself. The link for this book is down below. All of you that are potential coders, has taken your CPC and you need a brush up and you just forgot. Okay, this is where you're going to do your brush up. Okay, so you're going to get the E&M in here. You're going to get E&M, so you're going to get the guidelines, you're going to get E&M, and you're going to get integumentary and musculoskeletal system in this book. Okay, so we're not up to coding yet, but I wanted to put that out there, that book is there. Okay, so we are up to musculoskeletal system. So we really just went over musculoskeletal system, but I just want to kind of touch bases in your regular book. Okay, the musculoskeletal system includes the bones, muscles, and joints. We just went over that. All have important functions in the body. Okay, so when you guys do get your medical terminology book, your language and medicine book, this is what you will be going over. Okay, and we went over this. Bones provide the framework on which the body is constructed and protected and support internal organs. So we really just went over this, but I still want you guys to read this. Both a medical doctor, MD, make sure you get this down. On your CPC, they may ask you, what is the osteopathic doctor? What is his credentials? What are their initials? GO. So if you say both, I'm just giving you this. A medical doctor's MD, a doctor of osteopathy is DO. Okay, I'm giving you a heads up on that. And what I would do, which is a good thing for you to do, I'm just dropping this up here for a minute. Oh, I got to take that off. Take a look at, I would go online and say, give me titles of physicians. Give me titles of doctors. And then write them down. Nurse practitioners, XYZ. You want to know all their abbreviations and what they mean. Medical doctors that do everything, surgeons that are certified for everything. There are different DOs, DDAs, DDOs. I would definitely go on and pick that up. I can't believe we're 45 minutes and we just started. So let's just go through a couple of. So some of these things I want you to make sure you get down. Joints, put that on your index card, are the places at which bones come together. Several different types of joints are found within the body. Muscles, whether attached to bones or to internal organs and blood vessels, are responsible for movement. Muscles responsible for movement. So if you have something like that on your chest and it says, what are muscles for? They're responsible for movement. Okay. Tendons are connective tissue that bind muscles to the bones, while ligaments bind bones to other bones. That's wicked. Make sure y'all get that down. Okay. Make sure you get that down. And see, like you have some people, that's right here. So I'm on page 544. That's right here, y'all. Did y'all hear that phrase I just said? Let me say it again because tendons are connective tissue that bind muscles to bone, while ligaments bind bones to other bones. You got that? If you don't got that, what I would do is I would go to YouTube. Show me a video on ligaments and tissue. That's what you're going to do. And I love it because it's probably show you like this 3D thing and it'll show you like tissue and stuff attaching together. Why, Ms. Lambert? Because that's how you retain. You visually see stuff, that's how you retain. Okay? That's why it's easy for me to retain medical stuff because I was in the OR. I've seen these things. So me working in the OR, I know what a cardiothoracic surgery is. I know what a cranial surgery is. So it's like one side, when I was in the OR for only those 2 years, I saw so much stuff. 3 years. I saw so many things. It's like they stick. You don't forget those things. Okay. The only thing I want to forget is like the babies. When babies, have to have surgery and stuff. Okay, so so remember that those tendons and ligaments. Okay, orthopedics. I can't even say it. It's orthopedists are physicians who treat surgically and medically. That's in parentheses. Bone, joint, and muscle conditions. Originally, orthopedics. I see orthopedics. When did they get the DISTs? I don't know. Was a branch of medicine correcting deformities in children. They're talking about years ago, back in the days. Rheumatologists are physicians, non-surgical, non-surgical physicians who specialize primarily in joint problems. Like some people have, what is that? My cousin has lupus. But some people have lupus and their bones kind of fuse together. They need to see a rheumatologist. Okay, and it is kind of like arthritis. We did the medical Dr. Juan, both medical doctor, MD, and Dr. Osteopathy can specialize in orthopedics, rheumatology, or physiatry. MD and DO medical education program are similar, and both kind of physicians perform surgery as well. Okay, we don't even know all that. They ain't gonna ask you all that. They're just gonna ask you, what is a DO? Okay, what is a DO? Physical therapist, a chiropractor, we could do that part. Yeah, I just saw one around the corner there today, and I was like, wow, they know what they do. It's like this little tiny office, massage restaurant. A chiropractor is not a physician. Okay, not a physician. Let me clarify this, because one of my bosses, you could tell he wasn't a doctor. Okay. And I had to run his whole office, and he just what was his name? Dr. Ray? What was his name? That was my boy. What was his name? Dr. I can't remember what his name is, but he was a physical therapist. But anyway, a chiropractor is not a physician, but has extensive and specializing training in using physical means to manipulate the spinal column, joints, and soft tissue. A physical therapist is a doctoral degree prepared healthcare professional who develops a treatment plan based on a patient's physical impairments with or without a physician diagnosis. Are you guys clear on that? Y'all want me to read it again? A chiropractor is not a physician. Okay? A chiropractor is not a physician. Okay? Normally, the primary care doctor refers you to the chiropractor, or the primary care doctor refers you to the physical therapist and or the surgeon. Okay? A physical therapist is a doctoral degree. After your master's degree, you go for a doctoral degree. Okay, you can be called a doctor because of your degree. Okay, I was headed that way. I ended up getting two master's degrees instead of my doctorate degree because I wanted to do two different things. And of course, student loan. I owe $300,000 by then. Okay, so physical therapist is a doctoral degree prepared healthcare professional. Okay, who develops a treatment. You guys know what hierarchy is. Hierarchy as in doctors, and then it's healthcare professionals, right? So that's what physical therapist is. He or she is not a hierarchy doctor, but she is still a healthcare professional. Okay, who develops a treatment plan based on a patient's physical impairments with or without a physician diagnosis. Okay, so the goal of physical therapy are to restore function, improve mobility, and relieve pain. Okay, and relieve pain. I think Dr. What the heck was his name? Dr. Ray, Dr. something. He did athletic trainers. I think we were trying to get him certified to do this one. Are healthcare professionals who are working with a physician provided therapy. So just remember that when you guys hear people say healthcare professionals is down the hierarchy ladder. Up the hierarchy ladder, you start talking about doctors and DOs and surgeons and stuff like that. When you come down and you say healthcare professionals, you're talking about PRNs and different things and stuff like that. Okay, so just take heed to that. I'm not remembering anybody mentioning that being on the CPT, but in your CPC guide, in one of the chapters, we will read about the hierarchy doctors, okay, and the healthcare professionals. They are different, okay. Okay, bones, formation and structure of the bone. We just did that, but we're just kind of going over a little bit of this. Bones are complete organs composed chiefly of a specialized connective tissue called osseosis, okay, which is the bony tissue. Okay, osseosis tissue, plus a rich supply of blood vessels and nerves. Okay, I'm not going to read that whole thing. I'm on page 544. I'm hoping that you guys are going to read that. Okay, during fetal development, the bones of the fetus are composed of cartilage, which resembles osseous tissue, what we just talked about, but it's more flexible and less dense because of a lack of calcium, salts in intercellular spaces. So let me read that again. During fetal development, the bones of the fetus are composed of cartilage. Okay, well, we know that. That's why they're soft. And you guys ever hear your mom say when you have a baby, shape her head. My mom used to tell me that, about my daughter's head. And her little pea head wasn't no bigger than this. But, when you come out and it's such a small area, sometimes baby come out and have that cone. You have to shape their head. And my daughter's head was like this tiny. She barely has any head now. But I used to do this to her head and just kind of made sure she had a round head and nothing was difficult about it. I think all of my children, I have four. I have my two grandchildren. They all seem to have little round heads, just like mine. They have round heads. I don't have a small head. Y'all see how big my head is. I'm pretty sure my mother, she probably molded my head, but we don't have small heads in my family. I think my grandmother has the same kind of outlook, face like I do. Okay, so yes, so and that's because it can be done because a baby's head is not fully developed as far as your bones. It is cartilage. It's soft. It's still soft, and you still have that open up there. Okay, so calcium. The formation of bone depends largely on a proper supply of calcium. So what we're doing right now, what I'm doing is just reading these things to you, some things to you, not everything, just pulling out stuff. But what I'm going to tell you right now is CPC. These are the things I want you to know. That's why I wanted to go over it twice with you. So take heed to this. What? There are, I don't know if you guys can see those things when they pop up. There are 206 bones of various types in the body. So I am here, 206 various bones of the types of the body. And we talked about some of those bones, those long bones. We talked about those long bones. We talked about those flat bones. Okay, so there are 206 bones of various types in the body. Long bones are found in the thigh, lower leg, and upper and lower arm. Okay, I'm not going to go through that. I'm just going to give you the gist of what I want you to study for your CPC. Short bones are found in the wrist and ankle and are small with irregular shape. Flat bones are found covering soft body parts. Okay. Sesamoid bones are small. Now, the sesamoid bones, the bases of the skull, shoulder blade, ribs, and pelvic bones. Okay, sesamoid bones are small, rounded bones resembling a shape just like irregular bones. They are found near the joints. So those would be some of your irregular bones. So in your book, those of you who do have your book, I want you to complete this, okay? So, and if you don't have your book, you guys know where I'm going. I want you to go to elsevier.com and order your book, okay? Order your book from elsevier.com, okay? You can find your books right there. You can also go on amazon.com. Okay, so those are very important for you guys to study, especially for your tests. Okay. All right, so I'm now on page 546. So some of you already have your book, and I want you guys to still follow. Your page may not be 546. It may be 533, but we are still in the same place. New books have different pages. They add things, take things out. Well, they don't take things out. I think they just more or less add things. Okay, so we were talking about different types of bone fractures and bone marrow and stuff like that. Those are things that I want you guys to study. So right now I'm on figure 15-1A, and in your book you should be on the same page. The illustration that I just showed you, we're right after that. So those of you who do have your books, just make sure you do that test. It's not a test, just do the exercises that's in there. All right, so let's see. Okay, so I don't need to have like a description of the bones, but in the book, it is showing you in the book the types of the bones. It's showing you the bone and the number of the bones. That's going to equal up to 206. So if you are in your book and you see the shaft of middle regions of a long bone is called the diaphysis. Okay, 1. You see something in parentheses, it's 1. The epiphyseal line or plate is 3. You see, so they're just giving you how many bones that you have. Calcaneus bone 10, medulla cavity 9, compact bone 7. So yes, I want you guys to study that. Is that going to be on your test? No. Will they ask you process of depression of the bone process? Will they ask you on your CPC how many bones are in the body? Of course. How many bones in the body? I just told y'all. We already an hour over, but I'm almost finished. 206. Okay, 206. Go to page 5. Go to 546, and it will break it down for you. Okay, it's going to break it down. Medulla cavity 9. Okay. Okay, where am I? Processes and depressions in the bone process are large. Okay, you don't need that. Okay, so epicondyle. Make sure you guys get that. Epicondyle is small rounded process. Small rounded process. Epi means above. We know that. The condyle. Okay, bone head, rounded head of the bone. Okay, just epicondyle. Just make sure you guys get that. Put that on your index cards. I wonder why they don't have the. We went over the fractures in here, but I thought that they would be in here. That's weird. I'm looking for the bone fracture. Epicondyle, femur. We went over that. The femur, the humerus, bone head. They're not going to ask you that, but they will ask you. They will ask you these two. The femur and the humerus. So remember I said how I figure out which one is which? The femur is the leg part. The humerus, the hand part. So how I remember, I go H, hand, F, foot. That's how I remember it. Okay. So I'm still trying to see. I wonder why they don't have. That's weird. I was looking for the fractures, but I guess they don't have any. Well, we went over the fractures already, but I still wanted to see it. Okay, cranial bones. The bones of the skull or cranium protect the brain and structures related to it. Okay, so you guys seen that already, such as sense organs. Okay, I just want to make sure you see this here. We went over that in the Jones medical terminology a few minutes ago. But they do have an illustration in the Elsevier book. You guys can fill that out. If you need help with that, go back over this chat. The answers are in there. I gave them to you. Okay, the mandibular, see that? Did I take it down? Make sure you guys get this, because this is stuff that'll be on the test. The mandibular, make sure you know where that's at. Okay, your mastoid, make sure you know where that's at. See, they want you to put the temporal lobe and all that up here. Cranial bones, okay. You guys can do that, but that ain't what I was looking for. But you see right here where it has the number of the bones right here, frontal bone 1 forms the forehead and the roof of the bony sockets right there. You see temporal bones 3, you know, occipital bones 4. So, you know, sphenoid bones, go over these. Look, put these on index cards. TMJ, temporal mandibular, that sounds like something that was on the test, so make sure you get those, okay? Well, this is a good one right here. So this illustration you probably could use to get your answers from for that illustration that was up there. So you probably can use that to get your answers. Frontal bone, your ethmoid bone, sphenoid bone. See, certain stuff is on different sides. Temporal bone, occipital, and it's showing you that in the book. Okay, it's showing you in the book. Posterior, right here. Your orbit right here. In your CPT book, there's a lot of illustrations in there too. Your facial bones. And again, I want to show you something. Look, in this book, again, it's showing you see this right here? It's showing you how many bones. Okay, so that's what that is. And, you know, if you get the ebook or the hard copy, it's still going to show you the same thing. Okay, nasal bone, lateral bones, the 2 small thin bones located at the corner of each eye, maxillary bones, the 2 large bones that compose the massive upper jaw. Actually, I'm going to take that email. I get so much crap on that email. Not y'all's email, not the Sapphire email. It's a different email. Cranial and facial bones. Ethmoid bone supports nasal cavity and eye sockets. This right here, make sure you guys get this. Make sure you guys get this one down, okay? Because that sounds like vocabulary and definitions that's going to be in your test. All right, supports nasal cavity and eye sockets. Ethmoid bone, frontal bone, forehead, part of eye socket, occipital bone, back and base of the skull. Parietal bone, top and sides of the skull. Sphenoid bone, base of skull behind the eyes. Temporal bones, lower sides and back of the skull. Facial bones. Okay, I don't know why it says location, but I guess it's saying all over. Lacrimal bones, corner of eye. Mandibular, lower jaw bone. Maxillary, upper jaw bones. Don't get twisted on that. Watch that mandibular. Am I saying the right mandible? Mandible, lower jawbone. Maxillae, upper jawbone. Y'all know I can catch this, not to pronounce mine. You see these 2 right here? Do not get stuck on these 2. They look and sound the same. I'm giving you a word from the wise. In your CPT book, a lot of codes are going to look the same. Okay, a lot of codes are going to look the same. That's why this is going to be our go-to right here. Okay, I'm going to get a specific hard copy. I wonder, can I highlight on the all right, so somebody sending me all this nonsense. Okay, so I don't know if I can highlight on my ebook. I might have to get a specific hard copy. I don't know. We're gonna find out. All right, so I don't know, but I'll mess around with it after this class. But this is our go-to right here. Okay, because like I said, a lot of CPT codes look alike. Okay, nasal bone, bridge and septum. Okay, vermal, nasal and septum. Zygomatic bone, cheekbones. Zygomatic bones, cheekbones. Okay, so vertebrae column and structured vertebrae. We just went over that. The vertebrae spinal column is composed of 26 bones. Okay, called vertebrae. They are arranged in 5 divisions. Okay, from the base of the skull to the tailbone, the bones are separated by pads of cartilage called intervertebral disc. Okay, I'm not gonna go there. The neural or spinal cord. You guys are going to read that. So I want you guys to read page 552, 553. 553 talks about the vertebrae, thoracic, T1, T12, 2T12. You guys remember we did this one already a few minutes ago. This one just has the illustrations where I can show you. So you remember I was saying when I get ready to go through this, it'll be an illustration in here to show you. But when you get your book, you'll understand this more. The first 7 bones of the vertebrae column forming the bony aspects of the neck are the cervical, C1 to C7. So look, C1 to C7. So let me put this right here. You see, that's what I was talking about when I was showing y'all in the other medical terminology book. But here you can actually see the cervical vertebrae, C1 through C7. T, thoracic vertebrae, the T1 through T12. So when you see that on your exam, you know what it means. They're talking about the spine. They're talking about the spine. So let me see if they have a little more in here. So they should have the lumbar in there. They do. So the lumbar code, we're talking about the spine right here. And these numbers are the number of discs that you see in here. So the lumbar vertebrae is from L1 to L5 right here. The sacral is right here. This little see where it says coccus, that little piece right there. Remember I told you sometimes you feel something sticking you, might be irritated or something like that. That's the socket right there. But this is the sacral vertebrae right here. It's curving right here. The lumbar goes from L1 to L5, the thoracic T1 to T12. In the back of your CPT book, is it the CPT book? Yeah, in the back of the CPT book, there's an illustration back there with that in it. Okay, just kind of go over it. We already went over it in the Jones medical terminology, but I want y'all to go over it again. Okay, bones of the thorax, clavicle. We talked about clavicle. This is just I'm on page 55. This is just something like a test that you guys can do. Your sacrum, pubis, ilium. You remember that word ilium I was telling y'all about? That has to do with the digestive system, and then your ilium is like almost up your pelvis. This is it right here. Don't get these two twisted when you take your test. That's the other ilium that we were talking about. And the other ilium was in your digestive system. Okay? So don't get twisted with that. All right. So what do we have down here? Your sternum, your scapula. We talked about those things already. But I'm on page 555. I want you guys to go over that. Bones of the arm and the hand. The humerus, they start talking about the humerus here. So yes, I want you to read this. Radius, carpals, and metacarpals. Radius, lateral lower arm. Carpals, wrist bones. There are 2 rows of 4 bones of the wrist. 8. Metacarpals, 9, the 5 bones of the palm of the hand. Okay? These are just illustrations. We already went over this, but I still want you guys to look at it. Femur, patella, tibia, fibula, tarsals. You remember we went over that? That's on page 56. So tonight for your homework, that's what you're going to go over. That's what you're going to go over, okay? Is illustration 15:9. We're way over. I'm 13 minutes over. Okay, when you study tonight, that's what you're going to study. So those of you who are archiving this chat, that's what you're going to study. Your femur, okay, your hip joint, patella, your knee joint, your tibia, your shin bone, your fibula, tarsus, metatarsals, phalanges of the toes, okay, your heel bone, your ankle joint. That's what you're studying. That you don't need. Okay, that's your medical terminology. So you're going to do your medical terminology. Oh, you guys remember I was telling you something about the scoliosis? And scoliosis is your spine is curved. Here's a picture right here. See how that is like that? And it shows you right here a picture of scoliosis. A friend of mine had scoliosis. She used to run the front. And her son also had scoliosis. But you guys can read that, read about that. They may have, what is scoliosis or something like that. Just make yourself familiar with what scoliosis is, okay? Because when I finish with you guys, I gotta get rid of all these Yahoo stuff that's coming through my phone. Manda blue. Okay, so you guys got that. We're gonna do that. Okay, so these are exercises down here. I'm taking a look and see. I don't know what that's doing. If they have any cases down here. We had cases before. I know it make you want to sit up when you see these bones. When you see stuff like this, look, it make you want to sit up because you don't even know when you're doing work and stuff. You're doing things and you bend it down like that until you see somebody. Every time I see that thing on YouTube that pull your back up like this, that's when I go. It's crazy. So if you're sitting like that, sit up. So what we're looking for is, I'm looking to see if they have any, oh. It's late in this chat, but I did find the fractures. And here they are. I want you to study these, okay? Get this book from elsevier.com, and you're going to study these fractures. Why, Ms. Lambert? Because they're going to be on your test, okay? Musculoskeletal section, open and close, they may be on your test. They have been on some, okay? So make sure you get them. Very important, okay? Simple closed fracture, compound open fracture, I'm on page 568. Radius, okay? Closed fracture, your radius. Compression fracture, crunch. Comminuted fracture, shredded. Green stick, kind of bent. All right, so make sure you get those. Let me see which one I had trouble with. I don't know. Compression probably, because I don't remember that. But see, compression you would know. A compression fracture is, when you get compression fracture, think of somebody hitting you, think of you having a car accident. That's like a compression fracture when your knees or something crunch up like that. Okay, so think of that. Let me see what else. Oh, so what were we looking for? Oh, I was trying to see if there were any cases in here. Well, they have bursae, closed sacs of synovial fluid. So you guys are going to go over this one too. 567, they start talking about joint capsules, ligaments, synovial membrane fluid. Meniscus, and meniscus is a percent shape of fibrocartilaginous structure of the device. Okay, so you guys can go over that. That's not going to be on your test. Bursae may be on your test. Bursae and ligaments may be on your test. Tendons is on your test. Okay, I'm not going to read that, but I want you to. So you're going to read about the bursae, tendons, and the ligaments, okay? We've already done the female patella, synovial joint. Your vocabulary will be in there. Every single bit of vocabulary that's in here, you will look at. No, you don't have to write down every single thing, but I'll still want you to look at it. Just read it. That's all you got to do. Stenosis, spinal canal, we don't need that. I don't need that. I don't need the pathology part, carpal tunnel syndrome. So when you get to page 572, just kind of read up on the carpal syndrome, the bunion dislocation, herniation of the intervertebral disc. So what I'm looking for, that might be what's wrong with Trump. Let me see. Did you guys see that thing on there where they're trying to find out what's wrong with Trump's hand? I'm trying to find out too. Y'all know I'll be on Twitter forever. Um, Lyme disease. Lyme disease is in here too. Chronic recurrent disorder. I should be all right. It's malaria, amyloidosis causing bacteria carried by a tick. Yeah, who's that had that? Justin Bieber? No, the other guy. He had something like that. Okay, so I'm looking for tests. No, so all that. So they're pretty much talking about the muscles and the striated muscles and voluntary muscles. And we went over a little bit of that and in your arm with your nuclear. I want you to just make sure you get the nucleus down, connective tissue down. Oh, this is a good one right here. So I'm on page 578. I know I was going to do 2 sessions of this, but we started it. I'm gonna dead it at 125. So again, that's your musculoskeletal section. I want y'all to make sure y'all get that down. All right. The deltoid is the abductor shoulder. That's the abductor shoulder muscle. Occipital frontalis muscles. Ooh. Your tendon, Achilles. Y'all hear about that. I'm going to show you that right now. Your Achilles is right here. Y'all hear those basketball players when they hurt that? Ooh, I can imagine. But again, that specific phrase is going to be on your chest. I wouldn't single out anything. I'd study all of them. Just so you can look at them. If you get it on your chest, you can't say you haven't seen it. You might choose the correct one. You don't have to be a master at it. Just look at it. Okay. Smooth muscles make up the involuntary or visceral muscles. Cardiac muscles is striated in appearance, but it's like smooth muscles. Its movement cannot be consciously controlled. So I want you to make sure you get that down. Smooth muscle and cardiac muscle. Okay. What do they do? Okay. Radius. Oh no, we did those already. Your biceps. If you have something on your chest, where's your biceps? Where's your triceps? Oh, get this down to flexion, extension, abduction. We're still in the muscle area, but I'm still, this is in here, so I want you to make sure you get the abduction. Remember, we were talking about that with the hand away, abduction, adduction, abduction to hand away. So we'll say abduction, move away from the midline of the body, adduction, move toward the middle of the body. Make sure you get those 2 down. Plantar flexion. Don't beat me. Oh, here's a good picture right here. Let me show you this real quick. And we're done. We're done with this. We talk about the flexion. Make sure you guys get that down. That's going to be on your chest. You might get it, you might not, but again, it's still part of your medical terminology. All right, some of these pictures I can't show you. It's terrible. Not terrible, but that's not something that's going to be on your chest. I'm looking for a case. Okay, we've seen all of that. They're showing pictures of, a knee replacement. And my son's grandmother, she worked in, what do you call a hip replacement? I forgot. She worked in orthopedic surgery. And you're talking about some long surgery, 12 hours. And I guess they stand up so long, she ended up having to have a knee replacement. Because you stand up so long, She was OR tech for many, many years. How many of you are going in for OR tech? That's, you're the instruments, bring them in the room. The doctor pick the instruments. I think a couple of people going for that. There's a lot of tests in this portion right here. Make sure you guys get it. I'm just scrolling through to see if there are any cases in here. Bruce spent 2 weeks hiking and vacationing. Later developed a bullseye rash on his chest. Let me see. Yeah, no, that's not the case. That's considered an open and close. That's what that is. An open and closed question. Open and closed question. Okay, so I don't see any cases in this one. There are a lot of terminology in this section: lumbar vertebrae, mandible. Make sure you get that maxilla. Make sure you get that metacarpals. All these, I want you guys to make sure you get them down. I'm on page 608 right now. Osteomyelitis. Get it down. They're going to ask you some of this stuff, and it'll be multiple choice. And more than likely, it will be in a sentence, but you will see a lot of these terms, whether it's in a case, an open and closed question, or just throughout your CPC exam. Okay? There's a lot in here. Okay? They also give you suffixes and prefixes as well. I'm looking for. Okay, so that's it. That's your whole chapter, 612. That's your whole chapter. Peri, meta, infra, hyper, exo, dia, ad, dorsey, and that's your prefixes. Trophy, tome, stenosis, porosis, plastic, physis, penia, nausea, lysis. Those are all of your suffixes. Tibia, thorax, ten, tars. These are looking like root words. Okay, so we are done, Milo. We're done with this chapter, and it took us a minute to get through this chapter. But again, I want you guys to go to elsevier.com. This is where we get the books from. The link for elsevier.com is also below. The link for your ICD-10 book is also below. Really? So I have several links down there for you to get. This was kind of a long chat right now. And you guys can send me a message through chat or through my email, physicians@sapphirephysiciancoding.com, or you can send me a message through YTU. That's fine. YTU as in YouTube University. Make sure you go to Amazon.com. Get my medical terminology book. If you're at home and you want to learn a new skill and you do not want to spend money in a student loan, I encourage you to join this class. This is free learning, okay? It's free learning, free tuition learning, okay? You all know how anti-student loan I am, especially when it comes to medical billing. And this is where you can start. If you want to go further, you can go further. But as far as this class, we take beginners. Okay, we don't take people who are already experts. Okay, we take people who are beginners. I make sure that you start from scratch. We go from beginner to expert. So as we are going through these phases, this is for people who know nothing about billing, know nothing about coding. It will enhance your knowledge about medical terminology, and it will give you what you need to get through the coding. Okay. Again, if you have some words that when we get to coding that you don't know or something like that, just search it. The more you search in, the more you will know. The more you go to YouTube University or YouTube search, you will know. YouTube has so much stuff on it. YouTube is like, I'll tell you, I don't know who made this YouTube thing, but it is amazing. I've been on YouTube probably about 5 years now. And as you guys just look at my videos, every year I get better. Every year I get better. Look at the camera. And I mean, you have to invest. You have to invest. If you don't invest, you're not going to get better. I encourage everybody to get your books. I showed you guys a way to get the books free for the beginning until you actually can get your books. I have to see if the step-by-step book is also in the Kindle. I think we only did the coded books for the Kindle. But you guys can take a look in there and use those Kindle books at the best of your ability because they're free until you can get your book. The links for those books, like I said, are below. This book right here, this book came from Barnes and Nobles. So that's where I got this book. I'll probably go there tomorrow. They got nice books in Barnes and Nobles that I use for my class. I have tons of books. A lot of my books are not even here; they're still in New York. I have to go there and get them. But do not sleep on this class. You have to look at the chats. You have to archive the chats and get the information. It will motivate you to do what you need to do, especially all these people who have either been laid off or are not working. When I'm not working, this is me. This is what I do. I'm working on trying to do the classes at 100%. I have to have more views. You guys have to look at those chats. I have to have much more views in order for me to do 100%. And I think the more chats we do, the more people we get into the classroom. But we have to work on that to get the chats viewed. So don't forget, to look at these chats, go to the playlist. The playlist for the medical billing says medical billing and coding virtual course. That's all of the medical billing class. While you are in that class and you have a question, send it to me. If you want to get the Sapphire Physician Coding courses to go with that chat, sapphirephysiciancoding.com, click that tab and it's going to take you to my bookstore. Those courses are $9.99 to help you, okay? As soon as you pay, the courses are automatically downloaded, okay? That's also going to help you repetitiously with retaining information in regards to learning how to do coding, learning medical terminology, learning medical billing, learning ICD-10, learning CPT, and learning how to decipher the Hicksfix book, okay? Some of you who are not going on to the coding, that is fine. You still need to have that knowledge. YouTube has so much information on here that can help you. It is just ridiculous to go to school to pay $27,000 for medical billing and coding. Okay, so I want you guys to make sure that you take advantage of what YouTube has to offer you. Tell your friends, tell your neighbors, come to Sapphire Education. Here we teach medical billing and coding. And like I said, look in the beginning of that CPT book and it will give you a breakdown of how to use that book. I just gave you kind of a sneak peek of it. We're going to go through that. Okay, and again, you want to know what coding is. Some of you are new to coding or medical billing. Let me know. I'll break that down to you. If you go on sapphirecoding.com and hit that tab, it'll take you to the bookstore. If you get that orientation, if you just get the orientation, that will tell you about medical billing and coding. It also gives you a free orientation, and it also has the syllabuses in here. It has the schedules in there. So if you just get the orientation, just get the orientation. That's going to help you. That's going to help you. So if you guys are still with me at the end of this, I will see you next time. Look at those chats below. Make use of YouTube to help you study. Some people have trouble studying. Just find a rhythm. Find a rhythm. Again, this is your theory. Me teaching the class is the theory. The practice is you doing the exercises. Okay? The medical terminology book that I have, I have tests in that book. Okay, go to Amazon.com and get that book. Okay, just type in Lisa Lambert and that book should pop up. Or type in Sapphire Physician Coding and that book will pop up. Okay, so we are going to see you in class 12. I'm going to see you in class, is it class 12? I don't know what class is next. It's class 12, right? This was a musculoskeletal system. It's class 12, but I don't know what's next after that. Let me see. So we're going to be in temperamentary. We're going to be in temperamentary chapter 16. And in temperamentary, yeah, it's about as long as the one that we just did. So we're going to be doing integramentary next. But do not forget those free books are below. Hit the link for the CPT, hit the link for the ICD-10, and hit the link for the XP. Okay, that's going to give you a heads up. So we are hour and 35 minutes in. I'm going to shut this down. More than likely, we'll be on Monday. I don't think I'm gonna do a class on Sunday. You guys let me know if you need me to come in on Sunday, but we're gonna get back to our regular schedule Monday, Friday, and Saturday. Okay, but since everybody's off, I may do something before church or after church. Because I notice a lot of you will be on early in the morning now before church. So I might do something early in the morning before church. Okay, so, well, not that early, like 9 o'clock. So we're going to end this chat, and I'll see you guys next time. Bye-bye.